Hey everyone, welcome back. My name is Dr. Shayna Keller. I'm an owner of West Elks Wellness and naturopathic doctor in the state of Colorado. And this morning, I want to talk about birth control. And that article that came out about 6 weeks ago in the New York Times called Women Are Getting Off Birth Control Amid Misinformation Crisis. And something that really bothered me about that is they use the term trad wife, referencing traditional wives as the main culprit of the spreader of misinformation. We'll get into that, but let's talk about I wanna give you the outline of what we're gonna talk about first. So I'm gonna talk about all things birth control, including, fertility awareness methods, which are very effective and comparable to using birth control options when done perfectly. So we'll talk about perfect use and common use as well. Different types. I wanna go through the various types of birth control options, the reasons we prescribe them. I would say the reasons rational people prescribe birth control. Uh, Contraindications, these are huge, and this will give you an insight as to why having over the counter birth control might not be the safest option, although convenient. Also, wanting to talk about conventional use of prescription birth control. And then I want to talk about that article in reference to the quote unquote misinformation around weight gain, depression, and the choice in mate options. This is a really interesting one. Um, and I'm going to have some of my opinions scattered in here based on what I've seen clinically and what I've experienced personally, and just talking. Like, if you're a woman who is taking birth control, hell, even if you're a heterosexual man that's been in a relationship with a woman on birth control, you may have experienced some interesting things. I had, again, anecdotal, but nonetheless, a friend of mine back in college was on the ring, the vaginal ring, and it's supposed to be topical hormones right there only. And we'll talk about why I don't recommend that one. But he said that the boyfriend experienced symptoms from that. And he really did not like having sex with her because of that ring. And so ultimately, they decided for a different birth control option because it felt weird. And maybe it was a feeling versus like an emotional thing, but he felt like the hormones were affecting him. So again, anecdotal, but nonetheless, still a conversation that needs to be had. And my little sassy side mark is, you all know that if men had to deal with the garbage experiences of birth control, we would be not doing birth control the way that we have done it for the last 50 years. It is lots of side effects and it's gotten a lot better. We have a lot less estrogen. Anyway, let's get into some of the details. All right. So this is the article that I'm referencing. I don't know if you guys can see it. Yeah, this is the article. And this made a hoopla on social media. And some of the things that were discussed in there is like, hey, weight gain and depression, those aren't real side effects. You know what was really interesting, when I actually tried to find research in support of the weight gain and the depression, I couldn't find any data that was in support of it. I found lots of data that was inconclusive or did not find the negative effects of weight gain or depression side effects. So from a clinical perspective, and maybe again, it's the people that self-select and there's like a little bit of a bias. So I will say that coming to see a naturopathic doctor, um, have more negative effects from birth control and from medications. But clinically, there is a reason for this, specifically the depression. Birth control depletes many of our B vitamins. Many of you may know that B vitamins are very important for our nervous system to function very well. For example, B12 and nerve conduction. If we don't have enough B12, we can have like weird pain going on and like numbness and tingling. B6 is another one that gets depleted. And the thing with B vitamins that I want you guys to keep in mind is they are part of our detox pathways that are in our liver. And how are hormones broken down in our body? They are broken down via detox pathways in our liver so that they can be packaged and pushed out and pushed into our feces and pooped out. That is how our body gets rid of the trash, if you will. Now, if you add in birth control, which is more hormones than your body is usually taking, and then you add in the fact that they deplete these minerals and B vitamins, which we haven't talked about the minerals, zinc, manganese, and magnesium for sure. I should double check my notes, but copper might be another one. But nonetheless, zinc you need for immune system function, you need it for digestive function. Magnesium you need for a lot of things in our body. I think there's over 300 enzymatic reactions that our body uses magnesium as a cofactor. So hopefully this is making a little bit of sense. We have all these fancy biochemical pathways that we convert one thing into another, and that conversion reaction requires cofactors. Cofactors can be things like B vitamins and magnesium, which are some of the most common. Zinc is another one that's often used. I mean, really any of the minerals. And things are minerals like periodic table of elements, people, that we learned if you took a chemistry class, like those are minerals. And most of those minerals on that periodic table our body uses frequently. Although calcium is much, much more prevalent in the body, we use a lot of smaller, what we call micronutrients. We need small amounts of them, things like copper, manganese, strontium, boron, right? Things that we don't really talk about much in a clinical setting, let alone in a nutritional setting. It's like the nutritional facts labels, there's not like there's 5% boron in this, because it's a micronutrient. You need just enough of it. Okay, so there is a clinical rationale for depression. Okay, though I couldn't find any PubMed articles to support this, it is definitely something I see clinically. And this brings the question too, does research always move over to clinical, and are they equivalent? No, they're not. And this is one of the flaws of research. You need to take it into consideration, but not take it as the end all be all for everything in medicine or health. And so evidence-based medicine is made up of three legs: the research, the clinical experience of the practitioner, and then the patient's preference. So maybe my patients prefer not to take birth control, although taking a birth control pill is way easier than doing fertility awareness method. And often for my younger patients, I will recommend, because they're, less responsible, et cetera, just wanting to be more mindful of these facts. In addition to, they are easier to conceive than, a 25-year-old or a 30-year-old would. Anyway, I make the recommendation for birth control or an IUD for my younger patients. However, that being said, a lot of my younger patients are choosing not to go on birth control and are like super stoked about grabbing a piece of paper and writing out their cycle and tracking everything that's going on. Things that are important for cycle tracking include basal body temperature. No, that's not putting a thermometer in your vagina. Common misconception. It's putting a regular thermometer under your tongue. You want to get it to the the first decimal. I always forget what that's called. The first decimal. So like 97.1. You want to be able to see that point temperature, and record that. And you want to take that temperature every single day at the consistent time. So if you wake up at 6 a.m., take it at 6 a.m. and make a note, write that down. And what happens when you ovulate is your temperature grows up by almost a full degree in some cases. The second component that you want to track for is your cervical mucus. This is, I have patients all the time that check, I have vaginal discharge, but is it vaginal discharge as in like, oh, it's smelly, like you have BV or something medically going on? Or is that just the normal wax and wane ebb and flow of our cycle where we have some vaginal discharge? And our cervical mucus changes throughout our cycle. It kind of builds up, is like milky and creamy, gets a little bit thicker, a little bit stickier. And then the day that we ovulate, which is only a 24-hour window, it gets really sticky like a slingshot. They refer to it as egg white stickiness, which never really made sense because egg whites aren't really sticky like that, but slingshot. They kind of, you stick together and it sticks to your fingers. And if anybody wants a handout, I have a handout. I'm more than happy to attach in the show notes. Let me make a note of that. Attach the awareness method handout. Okay. So that was kind of a brief overview of the fertility awareness method. So we talked about cervical mucus, we talked about basal body temperature, and also how you feel. Like usually the beginning part of a cycle after menstruation, women feel awesome. They feel like they're the bomb. They feel good. They feel sexy. They feel pretty. Their strength is better. And this is shown. There's evidence that shows this clinically as well. And then you ovulate, and then our energy, we start to go a little more yin, a little more inward, a little more calm, quiet exercises, where we're spending time with ourselves, less out in the world, like running around, networking in my case. We just need a little more calm time while we're kind of feeling a little bit more inward. What are the other components? I feel like there's one other thing I'm forgetting. Anyway, it's in my handout. So the other types of birth control are oral contraceptions. So like the pill, that's what I took for a few years. There are dermal injections and there are dermal implants, neither of which I'm a big fan of, and I'll explain why here in a little bit. Intrauterine devices, so these are IUDs, and there's two main ones. There's the hormonal one and there's the copper one. And really, the thing with IUDs, you either love them or you don't. And this is the recommendation. I usually recommend the pill or an IUD, because IUDs, you just set it and you forget about it. This is the problem I have with the intravaginal devices, such as the rings, is you have to take it out and put it back in, take it out and put it back in. It's almost worse than the pill, because at least you can put a timer in your phone, or an alarm in your phone, and say, hey, like, I need to take my pill at 6 p.m. every day. Versus these devices, like, it's easy, especially if you're getting frisky, to like forget about it. And then, of course, there's like old school barrier methods, condoms and diaphragms. Diaphragms are making a comeback, and they feel a lot better than they used to. I do have a brand of diaphragms I like. In Colorado, can I prescribe them? I think I can prescribe barrier diaphragms. I can't do IUDs, but barrier diaphragms are non-pharmacological and they're really great. And you don't have to use those like really nasty spermacides as well. Like the brand that I usually like is called Kylena, I think. Something with a K. And they have their own, it's not a spermicide, but it's something that like coats around the cervix. Anyway, the most common reason I would prescribe birth control for someone is they don't want to get pregnant. Duh. Now, there are some other uses clinically that birth control does benefit. But again, I'm a lot more conservative on my recommendations here. I see patients that have endometriosis, which is a really painful, conventionally we think of it as a reproductive condition, and really it's a full body condition. It affects every system. I mean, there's even been cases of women that have endometrial tissue, that's the lining of the uterus, growing in other places in their body. And so then when they menstruate, they are bleeding from not normal places they should be bleeding from, right? That's because the tissue kind of, it's not cancer, but it's like cancerous in the way that it's like growing in the wrong place and it's growing too much. It's a very, very painful condition. And so I've seen birth control be helpful here while we're figuring out what else we need to do in order to help reduce symptoms and help this person get a better quality of life. So that's really the main two reasons that I would recommend birth control. Conventional uses, you haven't gotten your period yet and you're 15. Maybe you have anorexia. Maybe you're an athlete. Maybe there's a number of reasons you couldn't have your period. If you're 17 and still don't have your period, I would like to look at further causes rather than just say, let's give you a birth control. And we'll talk about why that's not a real period anyway in a moment. Acne, dysmenorrhea, or painful cramps. There's a lot we can do for painful cramps that are very, very simple and do not require you to take hormone birth control at all. In fact, I have pretty good success with this, not to toot my own horn, but I'd say within a month, most of my young patients that are dealing with really painful cramps are like, man, that next period, I felt like $1 million. And we do very simple interventions. You know why? Because they work. And my job isn't to prevent you from taking medication if that's what you really truly want. But like I said, most of my patients want to feel empowered. They come to me because they want to actually solve the problem instead of put a Band-Aid on the problem. Okay. I'm not against birth control. I took it for 5 years. And I took it when I was younger. And then I tried an IUD and it was terrible. And then for 12 years, I did fertility awareness method and didn't get pregnant, not even once, didn't even have a scare, because I understood how my body functioned. Most people don't realize you can only get pregnant 6 days of a cycle on average. Now if you have an irregular cycle, that's another conversation that we need to have. Another reason conventional medicine might prescribe you oral contraception or some other type of birth control. So let's talk about some of the reasons I don't love most of the birth control. The shot. I don't love the shot at all. It's a newer option with a lot of negative effects that can last up to a year after ceasing of the shot. I believe you get it once a month or once every 3 months. And, the effects, I just had a patient recently and she took it for 6 months and she's still dealing with the side effects of it. And she had really negative side effects as well. Anything that's newer, I'm more hesitant. I'm not the first person that's like, oh, brand new drug that just got approved last month. Let's try it on my patients. I want to see a few years of safety data, ideally 10 to 15, so we can really get a good idea of what the population experience of side effects and adverse events are, rather than us just jumping to conclusions and say, okay, yeah, it's safe because we tested it on 50 people. The implants. So the initial version of the implant, this is a crazy thing. So they usually implant it like into your inner arm, and there were actually cases of it floating and coming down into like the abdomen of a person, which is kind of insane. I don't want that for you. You don't want that. Um, if you really want to watch a documentary that'll like make your skin boil a little bit, make your blood boil, The Bleeding Edge, it came out in 2018. The main medical device they discussed in that was called Esure, which was intentionally placed. It was women that didn't want to get a hysterectomy, but they didn't want to have any more babies, or they didn't want to have babies at all. And it's like this little spiral metal device that was placed into the uterine tubes, formerly known as the fallopian tubes, with the intention of causing inflammation and scarring so that those tubes were closed up and would prevent the egg from dropping and meeting any of the sperm. Now, here's what happened instead. It caused severe pain in women because those little spirals broke apart into tiny little pieces and were found throughout the body. They caused uterine punctures. They caused extremely heavy bleeding and, 20 to 80 milliliters of blood per cycle. So per bleed. So the 2 to 5 days that you're bleeding, that's a normal amount of blood to have. If you're bleeding outside of that, not enough or too much, usually it's too much with these devices, um, that's a problem, okay? And a lot of times the implant and the shot, you don't even get your period, which I'm not necessarily against. I do think there's a lot of benefit though to us having our monthly period. It's referred to as the fifth vital sign for women. It gives us some information. Are you clotting? Is your blood bright red? Is it dark red? Is it brown? Is it scanty? Is it really heavy? Right. It just gives us another sense of like what's going on with our health. And it's something that a lot of women, especially those that choose the fertility awareness method, are a lot more tuned into their own body and how they feel, especially cycle to cycle. Let's see. The vaginal ring, I kind of talked about this already, but removing and not remembering, that's tricky. So that decreases the efficacy of birth control, right? And then the patch. I don't really know a ton about the patch. I don't know a ton of people that have used it. I haven't seen a ton of patients that have used it either. Most of my patients, I've seen the shot, the implant, the vaginal ring, and IUDs with the oral contraceptives, much more prevalent in my experience. So I don't really have a solid opinion on it, but I do prefer two options, either the pill where you have to put a timer and take it every day at the same time, or the IUD where you place it and kind of forget about it. Now, that does not mean that IUDs are without side effects. Most common side effects are severe cramping and heavy menstrual cycles, especially with the copper IUD. Some instances have found that the copper IUD can cause some form of copper toxicity for people that are sensitive. So just things to keep in mind. And now, back when I got my IUD, they did not have different sizes. They only had, two sizes. They had the copper and they had the Mirena. And now they've got like all these like smaller ones that are more appropriate for bodies that haven't had babies. So that makes it a little bit more amenable to cervix putting it in through the cervix and putting it into the uterus and not cramping and having such severe pain, which is by far the most common side effect. So people either love it, it's like painful for a couple weeks, maybe about a month, and then it seems to taper off, or it's just painful until it comes out. um, okay. So I want to talk about reasons why uh, you should not be taking oral birth control or combined birth control. Smoking. And we only have good data on cigarettes, and I'm going to say vaping and smoking cannabis too. Smoking of any kind increases affects your cardiovascular system in a negative manner. The reason this is most concerning, and this is like the biggest problem with oral contraception, is when you smoke, you're at higher risk of throwing a blood clot. When you take birth control that has estrogen in it, you're at higher risk for having a blood clot. So now you smoke, I don't care what you're smoking or what you're vaping, and now you're taking an estrogen containing birth control, and so bam, you have a double increased chance of having a blood clot, which are not fun. So you need to be very, very conscious of that. So maybe something like an IUD would be a better option for someone that's smoking, right? If you have a family history or personal history of a clotting disorder, if you have a family member like I do who has a clotting disorder, it's important that you get tested to make sure that you don't have a clotting disorder. Because again, that risk of a blood clot is very, very concerning, and we need to be very aware of these things. This is why I don't think that birth control pills should be allowed over the counter. I believe there's a progestin only. So the mini pill is what it's called. There's no estrogen in it. It's synthetic progesterone. It's not progesterone, it's progestin. Common misunderstanding: progesterone is a natural derivative of a hormone that our bodies produce, and the kinds that they put in birth control and hormone replacement therapy are progestins with an IN at the end. Okay. And that is important for us to understand because they have different effects in our body. Let's see. If you have a history of migraines, that's another reason to consider estrogen, to consider progestin only birth control options. Okay. Now, let's kind of talk a little bit more about how birth control functions to prevent pregnancy, especially the pill. So, like I was alluding to, you have the synthetic progestin and then you have progesterone, and we understand that those are different things and not the same. So, you might hear people on social media or even your own medical provider saying, hey, progesterone, birth control. No, sir, it is progestin, which is not the same thing as the hormones that our body produces. Basically, what the pill does is it tricks your body into believing that you're pregnant. This is why when you have the bleeds, you're not actually having a real bleed. That's just like you're taking a week off from the birth control. They're called placebo pills. They're a little bit of a different color usually in the pill pack. So for the patients that are prescribed birth control because they haven't gotten their period before, you're not actually having a real period. And I've seen patients that have had a really hard time getting their period back. You know why? Because the problem wasn't they were deficient in birth control. The problem was they weren't eating enough. They were exercising a lot. They didn't feel well for whatever reason. Maybe they had closet anorexia or bulimia and no one was having that conversation with them because it was normal and expected because of the type of athletic achievements they were receiving, right? I'm thinking like our dancers, our gymnasts, our swimmers. These are really common groups of women that end up with this, what we call the athletic triad: no period, disordered eating, and what's the other piece of it? I'm forgetting. I said it just a moment ago. Anyway, so let's look at the most commonly prescribed birth control medication in the United States, which is called Sprintec. So let's see. I'm going to stop sharing. We're going to share screen. So I love to tell my patients about this website. It's a free website put together by pharmacists and regulated by pharmacists. It's called drugs.com. You can look at it from a layperson's perspective. I have the professional one pulled up here. What I like about this is if there's a medication I'm not familiar with, or I want to see if the side effects my patients are having are from the medications they're taking, I just pull up my handy tool here. We call this a drug monograph, kind of is all the information we need to know about Sprintec. Okay. And in this particular instance, I want to talk about adverse reactions. So we've talked about this: serious cardiovascular and stroke. So that's the blood clots. Thrown a clot, thromboembolism is the medical term. So that's why smoking is contraindicated. I don't care what flavor of smoking you're doing. Contraindicated if you're taking estrogen-containing birth control. Okay. And that's same with the vascular events. And then liver disease, that's interesting because what did I say earlier? Where is birth control processed and packaged to excrete from the body? In the liver through our detox pathways. So it's important that we're not adding extra burden to an organ that might already have some damage, maybe from being an alcoholic when you were in college. Perhaps you have metabolic liver disease. Perhaps you have a congenital, something you were born with, liver disease. There's lots of reasons. You could even have autoimmune hepatitis or some other form of hepatitis, right? From, eating foods that were not autoimmune hepatitis you can get from eating something that was bad, like food poisoning. Actually, we don't always know what causes it. So, most commonly reported adverse events: irregular uterine bleeding, nausea, breast tenderness, and headaches. Okay, so this might get your thoughts going on why, like, having migraines might be contraindicated for taking estrogen-containing birth control. The reason I'm hounding a little bit on the contraindications is because a lot of practitioners, especially the ones that have gone through quick programs, like 18 months to become a PA, don't always know these important things. And I've had patients that had several contraindications and they were placed on combined birth control, estrogen and progestin, and it was not good for them. And they were having lots of bad side effects. So it's really, really important that you are an advocate for your own health. So, and as I alluded to, relating to that New York Times article that came out in March, I could not find any PubMed articles, so scientific data, that was in support of the weight gain and the depression. We already gave a reason for the depression. Now, is there any kind of clinical rationale for why a woman might gain a bunch of weight? Well, they have more hormones, you know. I can't really think of like a solid reason, like, physiologically why that would happen, but it happens. And if you're a woman, you probably know a woman that gained a bunch of weight on birth control. So let's not let there be because there's a lack of medical evidence, quote unquote, to support this, or the medical establishment is saying that it's a bunch of trad wives, traditional wives, wives that are saying they want to submit to their husband and have lots of kids and, F the medical establishment. The problem with that is that's one, dismissive language, and it's using language to say, like, what those people are saying is irrelevant, and they're missing the whole point. And in my opinion, a journalist that uses words like that isn't a damn journalist. That's a person that is trying to slander, and they probably got paid by some fancy pharmaceutical company to put this article out. And it was also written by a dude. Dudes don't take birth control. You take birth control as a dude, and then you can tell me you get to have an opinion about it. But what was really cool about my friend in that Nuva ring, he had a negative experience, and he was like, I think maybe you should change birth control. Like, there's a lot of power in being not only an advocate for yourself, but also understanding what the hell is going on. So, clinical trial experience. So as we're going through this, they evaluated 1,647 healthy women of childbearing age for a clinical trial. So we have to keep in mind these adverse reactions that they put in here. The problem I have with this is I would recommend that you guys read one or both of these books. The Truth About Drug Companies by Marcia Angel, former editor of the Journal of American Medical Association. She has a really interesting book. It was written in the early 2000s, I believe. And then another one came out from another medical doctor by John Abramson called The Sickening. He was on Joe Rogan. That's how I heard about his book. It was a little more practical and less doomsday than The Truth About Drug Companies, but both kind of fed into my thoughts about pharmaceutical companies, and even worse, about quote unquote grassroots organizations that appear to be nonprofits that unfortunately are funded by our favorite big pharmaceutical companies. And the other piece, why we're going back to the adverse reactions in, a little bit greater than 2% of subjects. Here's what pharmaceutical companies do. And this was outlined in John Abramson's book because he ended up being a witness on the litigator's side of drug companies that really screwed up and caused a lot of harm to the population once the drug was released from the FDA as quote unquote safe enough for human use, for the population to use, is what a pharmaceutical company will do. They will say, all right, we're going to go to so-and-so academic establishment, and we're going to say, all right, Dr. Billy Bob Brown, here is my paper. I want you and your colleagues to put your name on it. I am not joking. This is what they do. They are not giving raw data so that the scientists that are evaluating for the safety and efficacy of a medication to say, hey, is this a safe medication or not? They're just saying, no. Do you want to be paid? Do you want to be able to do your research and sit at your cushy tenure job at this academic establishment? Then you need to shut up and put your name on the paper. I know that sounds ridiculous and crude and crass, but it's not wrong. And this is the problem with academia, like taking money from big corporations, is then they're incentivized to find the yeses. And I'm not going to remember the data off the top of my head, but the amount of data that's published in favor of something, specifically pharmaceuticals or medical devices, versus against is substantially greater. There's very rarely something that you're going to find, oh yeah, the Sprintech, that's just, it's not a great birth control. It's not very effective. Who wants to publish data like that? But the reality is that is helpful information for us as scientists and medical professionals. So we can say, oh, there is actually some negative effects of this, and it's not actually the most efficacious. I'm making this up. That's not true about Sprintec. Sprintec is a solid birth control option, but you're kind of getting the idea here. So I don't trust nonprofits. I don't trust research fully unless I have been able to take a peek at the raw data myself, which we're not giving the option, not even as medical professionals and definitely not as lay people. So I take these adverse reactions in greater than 2% of the subjects with a grain of salt, is what I'm saying. Like it's significantly more than that. But so headaches and migraines were by far the most common symptom, almost 33%. Abdominal and gastrointestinal pain, about 8%. Vaginal infections, 8%. Genital discharge, so that's probably related to the vaginal infections, just about 7%. Breast pain, see, these are things we talked about. Now, here's the mood disorders, 5%. Depression and mood disorders, 5% of people. You notice that there's no weight gain on here. There's flatulence or farting, nervousness, and rash. Okay, so adverse reactions leading to a study discontinuation. So if they have a number of participants that are having lots of negative side effects, they are supposed to stop the study because the more harm that's being done, the less beneficial the medication is. And in this study, 11 to 21%, why can't they be a little more specific than that? That seems like a pretty broad spectrum in my mind. They discontinued due to adverse events. So out of the 1,600 women that were put into the study, 11 to 21%, somehow we can't have a specific number there, had some pretty severe symptoms. Menorrhagia, I believe that is bleeding outside of your normal, so like it's irregular cycle bleeding. Nausea and vomiting, headache, somehow that's different than the head pain up here. The headaches and migraines, so it must have been like really severe headaches. Severe mood disorders, 2.4%. Premenstrual syndrome, hypertension, that's another one that can happen. Again, those cardiovascular events, and why it's important that we don't have birth control over the counter. I know everybody wants that because it's freedom, the right to choose, and it makes things accessible, blah, 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 blah. But there is a reason medications are behind a paywall. And it's not because I don't want you to have access to birth control. It's because I don't want you to die from a stroke or have a migraine or have high blood pressure. And you weren't monitoring that because you didn't know because you're 17 years old. Right? It's just like, it's too much. It's just too much. Now, I do want to address something as relating to birth control. We have learned a lot since the 80s. The amount of estrogen that we have in birth control now is much, much more reasonable. Birth control today is much less associated with development of breast cancer. Now, there is still some association of breast cancer incidence. I would bet there's like some kind of family risk factors, maybe like their mother and their sister may have had breast cancer, may have gotten breast cancer when they were young. You kind of see, this is why we need a clinical professional to like go through and not just like willy-nilly be prescribing things. So breast cancer is less common as a reaction from birth control, although it still happens. It's much less frequently than it was from women that took birth control in the 80s, which had way too much estrogen. Okay, so that's basically what I wanted to go through, is like, you guys can look at this, take it with a grain of salt, but you guys can get a little bit of information from it. So we talked about the different types of birth control. My preferred, really, and actually I'll give you 4 are my preferred. 2 of which are birth control options and 2 of which are non-hormonal birth control options. So we've got oral, the pill, or the min pill. If you have any contraindications for the estrogen, which those contraindications are smoking of anything, including vaping, family or personal history of a clotting disorder, migraines. Okay. And then we've got the fertility awareness method. There's a few of them out there. That's not the only one, where you're tuned into your body and the rhythms of your body so you can predict with pretty high consistency. And this oftentimes uses the withdrawal method. And I know everybody's going to say, oh, that's how I got my extra surprise baby. But it is very possible when done perfectly with good communication between both partners. And then barrier contraceptions. No one likes condoms. Like, there's a time and a place. And if you're being promiscuous and wanting to prevent STDs, that is definitely a good place for condoms. But diaphragms, if you're with a partner consistently, is a great way to prevent pregnancy that's non-hormonal and less requiring of you to track your cycle if that's just not something you're into. Rational reasons for prescribing birth control. There's really only 2 really severe symptoms of menstrual issues while we're kind of figuring out some of the other stuff. And you don't want to get pregnant. Conventional medicine, really any kind of female issue, you're going to get prescribed birth control for this, that, and the other thing. Um, we went through the different types of birth control and why I don't recommend the other ones as well. I wanted you guys to understand. Oh, I didn't even talk about mate selection, but whatever. We're past that. Um, if you want to nerd out on mate selection, I did find an article in support of it. But again, this is the problem with research: is for every article you can find in support, you can find one that is saying, "Hey, that's not a real side effect." That was definitely something I experienced on birth control, and I know other women have as well. And I know I, N of one, that's not good data, but it does make my mind a little more open to the potential in some folks. We also talked about the difference between synthetic progestin and progesterone, which is your hormone that your body naturally produces. So if you guys have any questions about the fertility awareness method, check out my handout. I'm going to put in the show notes. And, it's not just a bunch of trad wives that are helping women get off birth control. Women don't want to feel like garbage. And like I've said before, if men had to deal with the side effects of birth control and the responsibility of it purely, we would have changed the system decades ago. So don't give me that crap about trad wives being the reason that people are spreading misinformation. A lot of my colleagues, a lot of hormone specialists, like I follow quite a few docs on social media, and they are also talking about this. It's not just me, and it's not just trad wives and like weird alternative medicine people. It's actual people with clinical experience that are saying, hey, these are real symptoms that we need to take into consideration. You know what I'd like to see? The raw data from some of these birth control options and actually see it to make my own educated opinion about it, not whatever paper that was published that was saying, hey, this is a good stuff. This is all the information that you need to know. And our 11 to 21%, why we can't have a more specific number like 15 to 17%? Why does it have to be 10 points apart? Like, that's ridiculous. So I really appreciate you guys tuning in. If you enjoyed this podcast or found it helpful in any way, please like and subscribe or share it with someone that might be wanting to understand a little bit more about birth control. My next guest is going to be the fabulous Dr. Pamela Snyder, one of my mentors. We're going to be talking about more philosophy, since it seems like you guys were really interested in that, so you can understand what separates naturopathic doctors from conventional allopathic medical doctors. Thank you so much. Have a good rest of your day.